What do you think of when you hear the word healthcare? It might be something to do with bills or money, or the cards that your parents show when you go to the doctor's office. But healthcare is more than a bill or a card, and it affects many people in their daily lives. This is most illustrated by the Affordable Care Act, or the ACA. The ACA is a reformed law that was enacted in 2010. It increased health insurance coverage, implemented reforms to the health insurance market, and possibly holds potential for a better healthcare system. Patients who were previously uninsured owing to prior diseases or a lack of financial resources can now get inexpensive health plans through their state's health insurance marketplace under the Affordable Care Act.
This policy, this transparency, will be the fuel for healthcare innovation.
Like with any law, some people favor it and some people don't. People who favor the ACA state that health insurance is now more affordable. People are no longer denied coverage, and more medical conditions are being looked at and taken care of. People who do not favor the act state that the ACA wants citizens to be insured yearly, and there is a fine if you are uninsured without an excuse.
Everyone has healthcare coverage.
Mm-hmm.
And the way they did it was, like, okay, you have options to enroll, but you must enroll. Like if you skip enrollment, then you're going to have some penalties.
Also, because of the ACA, new laws and taxes had to be introduced. Because of these new taxes, the wealthy have to pay more, while the poor still have to pay regular taxes. The Affordable Care Act provided additional coverage alternatives for low and moderate income people. Coverage grew across all racial and ethnic groups from the ACA's adoption in 2010 through 2016, with the highest gains coming after the Medicaid and Marketplace coverage expansions in 2014. Other U.S. groups who have historically been at danger for not having insurance, such as Latinos, African Americans, and the economically poor, have been impacted by the ACA. In less than a year after the exchanges began for enrollment, the total uninsured rate for Latinos dropped from 36% to 23%. The Affordable Care Act addresses workforce issues through a number of provisions, including reforms in graduate medical education training, increases in health profession scholarship and loan programs, support for nurse training programs, support for new primary care models like medical homes and team management of chronic diseases, increase in funding for community health centers and the National Health Service Corps, and support for school-based health centers and nurse-managed clinics. Healthcare is critical in our daily lives since it has an impact on our overall health. When we go to the doctor's office, we use healthcare. If we didn't have it, it would be far more difficult to obtain and pay for the resources we need to remain happy and healthy. It is now more easier to contact and pay our healthcare providers as a result of the act. Millions of Americans have gained insurance coverage as a result of the Affordable Care Act, which has also saved thousands of lives and enhanced the American healthcare system. People who were previously uninsured, had lower incomes, or had prior ailments, among other categories, have benefited greatly from the legislation. Working-age individuals may now access the health care they need to live a healthy lifestyle thanks to these expansions in coverage.